from the campus of the University of Nebraska at Omaha. Consider This, a program of issues and information behind today's news.
The 36-year-old woman arrived from Methodist Hospital to the Nebraska Medicine Biocontainment Unit by ambulance. You can see through the back window she's in a medical isolation pod. The healthcare workers with her wearing hazmat suits. She first became sick while on vacation in the UK and returned to Omaha on February 27th.
This woman got sick while she was over there, came back to the United States, went into the emergency room at Methodist Hospital yesterday, was tested. The team at Methodist did a great job of identifying her, got the test results back today.
We caught up with Governor Pete Ricketts at an event Friday night. He says a team of epidemiologists will investigate whether she exposed others to the virus from February 27th until now, and whether those people need to self-quarantine.
They'll interview the patient, they'll interview other family members, and start doing a trace back of all the people she had contact with, including the healthcare workers at Methodist.
He stressed now is the time for people in Nebraska to prepare.
Make sure you stock up on food, get your prescription medicine filled. Think about child care in case school is canceled, because again, you're going to have to take care of that, so now is the time to get prepared.
The state is constantly monitoring what other precautions may need to be taken to slow any potential spread of the illness.
So we'll be certainly looking at other measures like shutting down public events or schools, and we're going to be working closely with UNMC and their experts to be able to help us make that decision.
March 6th, 2020. That's when it officially began in Nebraska. 4 months later, at the time of this recording, the state has confirmed more than 19,000 cases and 274 deaths. Hi everyone, I'm Kathy Wyatt. Welcome to the 14th and final edition of a special weekly series on Consider This, COVID-19. Today's focus, where do we go from here? Joining us via Zoom to help answer that question is Dr. Adi Poor. Dr. Poor is the health director for the Douglas County Health Department. Thank you so much for joining us today. We appreciate it.
Kathy, thank you for letting me be here and invite with the community what we have learned over the last 4 months.
Yes, and I want to start by going back, Dr. Poor, to that very first case. The next day, you and other leaders held a press conference. What do you remember most about that day?
Oh, Kathy, I remember everything. This was devastating to me, and I still remember the time when the governor Friday afternoon announced the first case. And I knew at that time that I needed to have a news conference in Omaha and share with the community what we knew. So we got this together very quickly, and on a Saturday morning, here the governor came to the Douglas County Health Department. The mayor was there. The chief medical officer from the state of Nebraska was there. And we all had this united front, sharing with the community what we knew and what potentially is going to be in front of us.
Yeah, I guess as you're talking about that, Dr. Poor, how do you even begin to prepare for something of that magnitude? Do you recall pulling all the pieces together, all the people together, and thinking what's probably going to be the most important thing here today?
You know, I think we had some time in Nebraska. We were lucky. We are always a little bit lagging behind according to other communities. So I was pretty much prepared. I listened what other communities were going through, what other health directors in my positions were doing. So we had time to prepare, to plan. Our staff knew pretty much what was going to be the first and the most important thing that we were going to do. But you know, you are never as prepared as when it happens. And then it's always a kind of a surprise to your system, and you need to gear up and really try. The incident with this individual who had traveled from England, we knew every little bit of her. And I carried for many days, I carried all the stories around with me. I knew these individuals by name, I knew their background, I knew where they were infected. And so I was really, really involved. And I had fabulous staff. And in the beginning, you know, we were the first community in Nebraska, so we had help from the state health department. At the same time, everybody was getting on board and involved. And of course, that changed in the moment that more cases were in Nebraska and more communities were affected by this.
Yeah, and Dr. Poor, at what point did you realize that COVID-19 was going to be as big as it became? I mean, I can't imagine the announcement, then the days and weeks that follow, and then there's that realization. This is a really big deal.
You know, looking back, and it's always good to look back and see how this kind of developed. And I will tell you there for a few days, for a few weeks, as a matter of fact, I probably thought, yes, we have a few cases. Most of them were from people who had traveled outside the community. So we were able to contain it and see where they got infected. I think when I first started that this was going to be big is when we had the first community acquired case. I remember that day very well, and I thought, oh my God, we have just opened the Pandora's box. And so for me, it was very important when epidemiology staff called me in and said, we need to have a meeting. We need to explain to you what's going on here. We think we have the first community acquired case. I wanted to make sure that that was really true, that I knew that the effect of this was going to be widespread and was going to have an impact on our economy and on our daily life. And that's probably when I realized, oh my God, this is big. This is a runaway car train.
Wow, and this might be a good point in the interview to share with our viewers a little bit about your background. You know, for you, I think it'll drive it home a little bit more how you must have been feeling at that point to know a little bit about Dr. Adi Poor. What's important for us to know about you?
Well, you know, I have a very strong scientific background. My master's and my PhD are in toxicology, and I did a postdoctoral fellow in molecular pharmacology. So I have worked in the laboratory for many, many years before I came to the state of Nebraska as a state toxicologist. So I think I am very data-driven. It is, you show me the data, and then I make decisions based on data. I don't make decisions based on feelings, based on hearsay or so on. So I think that's very important for everyone to know. I also have a great passion for the community. And that's really why the field of public health is different from healthcare. If you think about a physician who has one patient in front of them and is doing a diagnosis of that patient at that time, for me, the patients are the entire community. And how do we as a community differ in regards to health outcome to other communities of the same size, of the same setup, and so on? So I have a passion for the health of all. And I have also a very good relationship with leaders in North and South Omaha, realizing that our community is only going to be as healthy as our weakest link. And so I see many of my work through a health equity lens.
Okay, and given that knowledge, that expertise, and of course that passion, what were you thinking then as the numbers started to climb in this state?
So I tell you, Kathy, every morning at 9 o'clock, I get a report from our epidemiologists. They get the data from the day before that comes in through midnight. I look at that data. There has never been a day where I have not looked at that data 5 minutes after it came in. I'm very interested, what does our data show? And therefore then, what communication do we need to give out to our community? Because I want to make sure that we are doing it right, that we are getting it to those who need the information, who need the right information to make the right decisions. Because so often, as you all know, we don't have treatments, we don't have vaccine, so we need to have behavior change. How do I communicate those behavior change in the most effective way? So Data drives my decisions for the day. Every day we do a news release to share the numbers that we have, and every day I try to find a message that we need to communicate to our community in that news release. It's not just numbers. Behind those numbers, there are lives. And we need to make sure that I know overall what do the numbers express in our community.
Yes, and we will talk more about that. We do have a graphic that we want to put up for our viewers. And as we're putting that up, this is new daily cases since January, Nebraska compared to New York. What can we make of this, Dr. Poor?
Yeah, you know, these are graphs that I look at every morning too. And this is it's very telling to me. For example, you can see both Nebraska and New York had rising cases. What this graph shows me is how New York actually got to drop their cases in a very quick manner, which is quite different than Nebraska. In Nebraska, we are seeing a decline, but we are seeing a slow decline. And I'm seeing this now every day as we are looking at data. I'm seeing it again today. We have around 50 to 60 cases. We are staying in that amount of cases per day over the last few days, and actually weeks, so to say. So I actually like our curve better, because it shows me that we are decreasing slowly. We are not decreasing rapidly and then also potentially can increase rapidly, but we are seeing a slow, steady decrease. And that is what I hope we are going to see. Some of the increases we have seen due to specific clusters in Nebraska. We know the food processing industry has had quite a few upticks. And so when you see that level increase, that probably was due to those clusters. We now see the clusters have gone away, and now we are seeing some of the declines.
Okay, so when you say you like what you're seeing with Nebraska, what does that mean that we're doing well? We just as the community members, you know, as you look at all of your data and you prepare all your reports, you know, talk with our viewers about what the communities are doing well.
I think the community has realized the governor didn't do a complete shutout. We said at that time, and he said at that time, let's really make sure that we have measures in place, but we also give some responsibility to the citizens of Nebraska that they have to take on personal behavior changes. And I do think we have seen that in Nebraska. Nebraskans have stepped up to the plate in that regard. Now, I have to say, with the good comes the bad. And I still see some stores that I go into, I am very proud of, because I see everyone is wearing a mask. Everyone is doing social distancing. There are only so many people going into the store and so on. And then I do see some stores where I'm thinking, this is not right. People are not taking it seriously. So I do think in general, people are taking it seriously and are taking the precautions that are necessary. So I want to compliment all of us, all of the community, because we are in this together. And so honestly, every time I walk by somebody who's wearing a mask, I want to say behind my mask, thank you. Thank you to all of you who are doing this.
Yeah, and with Nebraska, having said that about this particular state, as you look at the country overall, Dr. Poor, who else seems to be doing a good job in terms of that data that you're seeing?
Well, you know, I do have to go back to New York City, because we do know how New York City overwhelmed their hospital systems. All of us have seen that data, and I do think they were very firm in what they required from their population, and therefore the outcome, the results are really in that same direction. At the same time, however, I do want to go back and I do want to say, our healthcare systems did a wonderful job. And I have to call them out because we flattened the curve, but we never overwhelmed the healthcare systems. We had talks with the CEOs of the healthcare systems every morning, and very often they shared with us that do not worry, we are in communication together, and if one of the healthcare systems is more overwhelmed, the other one will step in. So I think we have this community well covered with healthcare. So that's another thing that I really want to say was remarkable in Omaha specifically.
Okay, thank you. And I know we are in the middle of the summer right now, and people are looking at taking vacations, maybe even leaving a state that seems to be doing things well, like Nebraska, to go to another state that maybe isn't faring quite so well. Dr. Poor, what would your advice be to people who are planning those trips? You know, I know it starts closest to home and you want to be doing what's right in the grocery store and the other places, but then you head outside of the state where you have, you know, you can be in less control of your situations. What would you say to those folks who really do want to travel this summer but want to do it safely?
I would say, you know, take the same precaution. Try to do social distancing. And if you go into a place, be it a grocery store or retail store or a restaurant, and you see there are too many people in there and no social distancing or very few wearing masks, I would turn around and not go in there. Try to be safe for yourself. This is your health and the health of your family and your loved ones around you. So I would say take all the precautions that you have taken up to now and really let us move through the summer in this. And don't look at the behavior of others, but you are the example of behavior. And if you have the right behavior, people are looking at you and are saying, oh, this person is taking it serious. I probably should take it serious too.
And speak a little bit to, maybe you have a story that you would want to share. You know, folks, this has been going on 4 months, and there are folks out there who are saying it's time for me to get back to, you know, where I used to be, and I'm going to be okay, and, you know, I just want to have fun, and this is just one time. Is there a story or something that you can share with individuals? Obviously, we don't have your perspective. You're the expert here. How would you drive that home to somebody who's great people, but they just want to go out and have fun, and it'll just be the only time? What would you say to them?
I would say it's not. I would say you need to be recognizing that nowadays we are finding so many asymptomatic individuals. So you may have no symptoms. You may feel perfectly fine. I just got off a phone call 5 minutes ago from a facility who called me and said they tested someone. They had no suspicion. The individual had no symptoms, was a younger adolescent, so to say, tested by chance and tested positive. So this is a lesson to all of us that, you know, there are more and more individuals that are asymptomatic out there, and only if we all take it serious. Another story is from an organization who called me yesterday and said they were handing out masks, and somebody came up to them and said, "Why are you handing out masks? I thought this was over." It's not over. It's not over. We are in the middle of this, and this is going to go on in fall. And we want to open schools safely. We all want to go and start our economy again. We all want to go back to work. But we only can do it if we really battle with this virus. And that's what it is. It's a battle. It's a battle. It's a virus so small that has all of us humbled.
Yeah. And like so much else, we do look to leadership, kind of take a cue from that. Briefly walk us through the chain of command in terms of the leadership in a pandemic like this.
You know, in a pandemic, of course, the biggest leadership comes out of the WHO, because a pandemic usually means it affects many, many different countries. So I still remember I was waiting every day to hear that declaration from WHO. Probably came late. Some of us thought it should have come a few days earlier. But anyway, it came, and then it was, of course, followed by the US president Then our governor declared it a public health emergency. Our mayor declared it an emergency. And so it kind of trickles down to the local level. I have to tell you, over the last 4 months, I've never had so much interaction with our governor, with our mayor, all of them really wanting to do the right thing within the job that they have. And I acknowledge that clearly, that, as a governor, there is a different position that you are in and different considerations that you have to take instead of a healthcare director who only can think of it through a public health lens, but not so much through what does it do to the economy. The same thing goes for the mayor. But both of them, I have to tell you, they would listen to my recommendation. They would hear my recommendation. They didn't follow them all the time, and that's not my expectation. But they were very open-minded and wanted to have input. And I think that's what leadership is all about. You try to get your input from the individuals that you trust and that you think have the best information for you.
And that is one of the things that I continue to hear coming out of this when we look at the positives of something like a COVID-19. It's tough to do that, obviously, but is that collaborative piece. People who are being brought together who would not have otherwise been brought together are not only meeting, but they're really doing great stuff by getting to know one another and moving forward with that knowledge, expertise, and passion that you talked about earlier. From your perspective, from where you're sitting, talk a little bit about that collaborative piece and maybe even a few folks you've met along the way that you wouldn't have otherwise met had this not happened.
I tell you, I have made a lot of friends. And often we joke and we say, we have seen each other on Zoom. Hopefully one of these days we can have a cup of coffee together, because we have gone through these very difficult decisions together and have really started to appreciate and got to know each other. I know now all of the superintendents in the Omaha area. We are on a call together once a week. I know individuals in hospital systems, of course, community leaders that I have known before, but even now I know them more often. I know senators much closer than I've ever known them. I even know some of their private things that are occurring in their life. In public health, there is not a 5-workday week anymore. It is 7 days a week. It is in the morning on Saturday, in the evening on Sunday. It used to happen actually for about 3 weeks. We had a call every morning with people from UNMC, the governor involved, and some of the local leaders at 9 o'clock every morning. And it wasn't until at one of these calls, the governor actually said, "Do you think we could take a day off and just not be on this call every morning, 9 o'clock? There was quite a bit of hesitancy because we all were in this. We need to know what is going on. We need to make decisions on it. But we finally were able to say, yes, let's step back and let's really try to put this in perspective too and have just a little bit downtime for ourselves for 1 or 2 hours. This has been stressful for everybody. And I always say to my staff who has worked so hard on this, we opened an information line, probably one of the better things that we did in the Douglas County Health Department, because I felt the community needed to have a place where they would get credible information and where they could put forward their questions. That information line, we celebrated about 2 weeks ago the 10,000 caller that we got on that line. And now, just yesterday, we had the 1,000 call in Spanish on that line. But I always said to all of my staff, I said, we are all stressed out. So let's give us a safe space where we can forgive ourselves if we say sometimes or have a tone in our voice that is not the most pleasant. But we all know we carry so much burden on our shoulders at this time. So we have all worked together. Like I say, I have partners in the community now. The mayor and I have never spent so much time talking to each other, texting each other, any time of the day. And I'm so thankful for all of these individuals just being human beings and being open and having these discussions and these conversations together. So that has really been something that honestly I will miss when this pandemic is over, even so I won't miss it if the pandemic is gone.
Yeah, thank you for that. I know one of the biggest things that people are looking toward, Dr. Poor, is a vaccine, and it's going to be a little while before we get there. In the spirit of this, where do we go from here? Especially mindful of those older adults who've been in isolation now for 4 months, trying to find an end in sight somewhere. What would you say to Nebraskans right now who are holding firmly to that hope of getting a vaccine in terms of what do they do between now and then? And we just have a couple minutes remaining.
You know, Kathy, you are so right. I think our elderly and our vulnerable population, they have really suffered. They have suffered mentally because they did not have connections to their loved ones anymore, or just to colleagues and friends that they have. So we need to take that into consideration and now really think about reopening. How can we socialize again with those individuals safely? You know, it's going to take a while till the vaccine is going to be available. There may be later on this summer, later on this fall, the end of this year, or the beginning of next year. But until then, I think we still need to say we need to be vigilant with our surroundings, but also try to take all the precautions that we have to be able to have a conversation and a relationship again with each other.
Yeah, very well said, because I do know that there are folks out there who every single day will ask the question, when do people get to come in and see us? When will we get to that point? So I think that your comments were very well taken. 30 seconds, final thoughts, Dr. Poor?
You know, the final thought to me would be, this is not about me, and it's not about a single person. This is about the community as a whole. So let's not think about me, let's think about we. Okay. What can we do together?
Thank you. We do have a graphic we want to put up for our viewers in case they want more information. The CDC, DHHS, Douglas County Health, NebraskaMed.com. Dr. Adi Poor, thank you so much for being here today and for sharing your time and expertise. Best wishes to you moving forward. Thanks for everything you're doing.
Thanks, Kathy.
You betcha. And thank you all for watching. We'll see you next week.
Consider This is an issues and information program produced by UNO Television. More information and program archives can be found at netnebraska.org/considerthis. If you'd like to share your comments about this program, call UNO Television at 402-554-2516 during regular business hours, or send an email to cwyatt@unomaha.edu.